Welcome back. I think this last session and the session flow so nicely together. Our next session is on supporting stroke care partners, and with us to provide the presentation, we have Kenya Harris. She serves as the Participant Engagement Coordinator with the UAB School of Health Professions Research Collaborative, where she oversees the NCPAD call center and a key research initiative. She earned her bachelor's degree in psychology and master's degree in social work from the University of Alabama at Birmingham. Welcome.
Hi. Thank you, Stephanie, for that introduction. Um, I know webinars, I'm talking to people. So I try to make interactive. So, if y'all could do the polls, I can know that I'm actually talking to people. That would be great. But yes, my name is Kenya, and today I'm really talking about how to support stroke care partners. So we're going to be talking about different things. Let's see. And so I really first want to give a shout out to IPSEN, the sponsor for today, for allowing me to come and do this webinar. Really grateful for this opportunity. All right, so today I really want to and I use the term care partners because caregivers, when you give something, it's like it's you're constantly doing it right. But when you say care partners, it's more of a collaborative space. So that's why I like to use the term interchangeably, because to me, care partner sounds more as it's a collaboration between whoever you're caring for and you. That's why I use the term care partner. But I really want to equip care partners and professionals with practical tools to manage stress, confidence, and strengthen communication. I want to foster a supportive space to share real experiences, even though we're on a webinar. When the polls come out, that's your opportunity to share what your experience is because everybody's experience is totally different. And I also want to give you all, you know, participants of today's webinar some resources. I'm a social worker by nature, so I love to help people through resources and connecting people with services that will make their lives much easier. This work matters to me specifically. And if you can see on this picture here, it's two women. So my mom, is the lady that is standing over my aunt. And so I have been a caregiver, care partner for my aunt who experienced a stroke like neurological episode nearly 15 years ago. I have been I started when I was very young, taking care of her and helping my mom. My mom is a nurse practitioner, so that was something that naturally just kind of came to us. And I've recently just moved back home with my mom, so I am back in the house with my aunt and also to my grandmother who is has late stage dementia. So I have seen caregiving or providing care for someone in all kinds of realms. I remember being young and trying to figure out what is this, what is going on. I just know I'm supposed to help. Like, what is this for me? And now that I'm older, I've experienced it and seen it a little bit differently. So I too have empathy for care partners because I know it, I understand like the emotional and practical sides of caregiving. I've been there, I'm there now currently. So really just trying to keep the things that I tell other people to do, also to take those things in as well. So yes, that is my kind of my why and why I was excited to do this. So I think one important thing about learning the stroke stress cycle, and we're talking about specific for care partners, right? What that looks like is very important. So what happens is we start with something that's triggering, right? We go from a triggering event to a stress response, coping, and recovery. So, what I mean by stroke specific triggers. So, for example, changes in loved ones' mobility and communication. We know that that is going to be something that is the new reality of things, right? So, that could be something that could be triggering to something stressful. Just, digesting that in general is something that could be stressful. Really, the second or another one would be transition of care. So just for example, if somebody is transitioning from the hospital to a home or another facility, that could be stressful. Um, Balancing caregiving, work, finances, and family demands. So those things don't stop. Even though these things, this event happened, those things don't stop or change. Also, to understanding what caregiver or compassion fatigue is. And this is anybody that's in a helping field or helping profession. Compassion fatigue is something that happens where kind of the weight and the grunt of everything is just it feels like it's on you. I like to describe it as like bricks are stacking up on you, right? And it's starting to affect how you sleep, how you think, how your experience. So I think it's important to understand the specific type of triggers, and these are just a few, right? There's different things that could be triggering to really cause stress to happen. So the process goes, we get triggered by something, right? So a new event happens, then the response to it is kind of what we do initially, and then we go into this coping phase if it's positive coping or negative coping, and then recovery. I think the major thing or what is most important about the stress cycle is the fact that completing the cycle is important because I feel like a lot of times we get kind of stuck in one or two phases and we can't get to the recovery process. So hopefully today I can give you some type of skills or coping strategies that you can use and take on as a caregiver. Really, uh, so I have a poll I'm going to put out and let's see what we get here. Okay. So which part of the stress cycle is the hardest for you to complete? Let's see. It's looking like the one that most, and of course, is the finding the recovery time. I think that is very true and practical. And that's a fair feeling to have. Like, because you're especially like if your day is already planned out or you have other factors into like your schedule. I think that is something that a lot of care providers or care partners experience. So that's very true, and definitely want to validate that. And the skills that I talk about today, or the coping strategies that I talk about today, I think the biggest thing is trying to figure out what works best for you, right? And I think that's a great transition to my next slide here. Thank y'all so there are people, yes, there are people interacting. Thank you. There's people here. Um, I'm gonna end the poll now, but um, and I can share the results so everybody else can see that. um everybody else can see the results. Also, to this also shows that you're not the only one experiencing this, right? This is a community of people that experience the same thing you're experiencing. So the other ones were taking action and recognizing stress. So yeah, it's like the thing about it is cycles, people are at different points, right? So I think the biggest thing, like I said, is to really try to finish the cycle. Because if you can get to the recovery part, then it'll be easier. Because these things are going to come up always, right? Triggers are going to always change. Things are going to always change. But the better or the more that you practice the cycle and kind of getting to the end is important. All right, I'm going to stop sharing. Go to the next slide. So, as I mentioned before, I think coping strategies are very important when it comes to finding strategies that work very best for you. I know when the way that I deal with stress is totally different from the way that my mom deals with stress, the way that my sister deals with stress, right? And it may show up in different ways in our lives. So these are just a few of some evidence-based practice strategies. I kind of went back to my program where we talked about the different types of therapeutic spaces and practices that there are. Mindfulness-based stress reduction. Being a part of NICPAD, I've got the opportunity to be a part of our mindfulness classes that we have. And seeing that, mindfulness is truly a practice of its own. There are people that practice that, and that is they are practitioners, and it's truly an art to me, an art of its own. But some few tips are mindfulness based stress reduction tips would be mindful breathing. I think a lot of times we don't realize how powerful our breath is and breath work really is, and how just breathing properly and listening to yourself is one way to stop and reduce stress. When things are really heavy on you, sometimes, and it's funny to say, but this whole concept of catching your breath is important. So stopping and really listening to your heartbeat, or stopping and like sitting in silence, those are really just ways that you could get control of your somatic or your physical body to kind of help de-stress. Single tasking. So one thing, an example of that is, so for example, if I know that today I have to take my aunt to her doctor's appointment, but I also have to go to work and I have to go pick up my dog or do all these other things, right? Single tasking, taking one task at a time. Things can be overwhelming if we're looking at the big ocean of things that we have to do. That just kind of adds to the whole concept and the thing of, I have to get everything done right now. So sometimes I tell people, just get through the next minute. That's important. Let's get through the next 5 minutes, right? Versus let me get through the end of the day. Sometimes it's let me just get through the next 30 minutes, right? So tasking or taking time to just really lay out is important. I use that as well. It has kind of helped me because some days it's harder to just be like, I want to get to the end of the day. Or people say like, I want to get to Friday. Well, sometimes I'm just trying to get to 1 o'clock, right? I'm just trying to get to the next hour. So taking things one by one, I think is important. And body awareness. So realizing when our bodies have natural ways of showing that we're stressed, right? I know that when I start to get anxious, my hands get really clammy, my stomach is in a knot. So really tapping into our somatic responses to stress, our body responses to stress, and knowing that, okay, I have been in this or I have been feeling this way for a long time. I may need to pump the brakes on something, right? I need to maybe stop and check in. And a lot of times when you stop and check in and pay attention to our body, because our body keeps score, right? It tells, it's our way of letting us know that, hey, something is not right here. So really tapping into that body awareness. And a grounding exercise that I really like to do is to put my feet flat on the floor, and feel like, do a mindfulness thing, body scan. So I can feel my fingers on my pants and feeling the fabric, right? That's a way for you to be in tune with your body. Cognitive reframing is one of my favorite techniques that we have. So managing guilt when progress feels slow, because sometimes I know people's recovery process looks totally different after having a stroke. So some days, and I have a friend that works in PT, and she talks about how she has to constantly tell her patients that like every day is not going to be a good day, right? But understanding that process of recovery, or the saying that recovery looks different for everyone, that's very important. But really digesting what that means. So maybe the person that was in the room with my loved one was able to get up and get released and do all these things. Meanwhile, that's not your reality. I think that kind of helps manage that, or cognitive reframing that, to be like, this is my loved one's journey. So an example of that would be, initial thought, I should be able to do all this by myself. Asking for help is a weakness. So there is a lot of negative thinking in that. So negative talk, negative thinking. So the way that you would reframe that would be, it's okay for me to ask help. It can strengthen my relationship and help me be more effective. See how that tone change, and it could change your like thought process. Um, that is something that's, I think, very important. And you can use cognitive reframing in all areas of your life, not just, this specific situation. But I, I think for me, one example for me that I can talk about with that is, and I can do this with my grandmother who has dementia. this whole concept of that, my grandma is not going to be the same person that she was before. And so instead of saying that, I could say, I know now that there's a new reality of who my grandma is to me, but she's still my grandma and I still love her, right? So that way of taking a negative thought pattern and reframing it cognitively really helps the situation. Behavioral activation. So this is kind of one of the harder ones, which we mentioned in the poll of taking time to schedule activities outside of caregiving to prevent isolation and other things. I know that it's a hard task, but I tell people sometimes it's maybe 10 minutes or 30. I think people too get this whole concept of self-care, and like sometimes we paint this like gloss over reality of what self-care is, and it's different for different people, but definitely want to just take the time, even if it's 20 or 30 minutes, to read a book that you like to read or do something like that, and which I tie to physical wellness, because keeping your body managing stress, or keeping your body is important with managing stress, definitely. Going for short walks, it's been scientifically proven that going outside, as people say, touching grass, definitely helps. Your body takes the information in and it's calming. So just, you know, really finding what works for you. But I think it's just the concept of doing it. And it's such a hard task because you're um guilted with the concept or the idea that, you know, who else is gonna take care, what else is gonna happen if I'm not able to do these things. And, I think that's once again, another fair experience to have. Especially if you're like the only person or the main person that is primarily taking care of your loved ones. So just once again, I'm giving these things to prime you to think about these things. All right. So when you talk about building confidence and communication, so there is a theorist, Bandura, who came up with this concept of self-efficacy in 1977. So this whole concept is that if I believe that uh, I can control my outcomes and influence things, then that will better chance my outcomes. So if I believe that I am confident in my ability to um, handle the challenges, I have better chances of having a better mental health outcome and care outcomes. If I believe that, I'm in this space to where I can do these things and I can get through this, then I'll be able to move forward. So some strategies that are based on the self-efficacy theory is using short, especially when you think about like communication. We know that after someone post-stroke or having someone that's having a stroke, communication is going to be different between you and your loved one, correct? So we really want to try to think about what communication looks like and understanding that it may be different. Of course, using short, and I'm really speaking to maybe the newer um, care partners for someone that had a stroke or who've not been in this space before, using short, clear phrases and allowing extra response time. I think patience is always something that having is something that we have to grow through because it's a new phase in life. And so um, it's very, we never know, right? So validating to the emotions that your care partner or your loved one it will be having is important. So I can see that this is frustrating. Like I remember specifically when my aunt got out of the hospital, she went to a nursing home and she had to learn how to walk and talk and eat and all these things that we do every day. She had to relearn how to do those things because she was in a coma for 41 days. And so I remember the frustration that she had because she used to be this woman that, took care of everything by herself. And now she's in a space where someone else is caring for her. So, understanding that, you know, the person who's experiencing this may also be frustrated and upset with the situation. So just trying to really communicate and read in between the lines with that, I think is important. Encouraging independence where safe. Definitely want to highlight and emphasize on it where it's safe, right? It's boosts the survivor's confidence and also too gives you relief. I know that's a process too. That's not something that's easy. That is probably later or latter part of your journey, but I think it's important because for one, that collaborative space, everyone involved kind of gets something from that. Um, and I know too, sometimes as humans, it's hard to communicate when we're frustrated or we're trying to navigate things. So just kind of being reminded of calm and consistent, I think is important. Um, and it's hard, and we're, like I said, we're humans and we're responding to our environment, as we should. But I think it's the art of, or the practice of, catching yourself when you feel yourself being frustrated and maybe I need to take a step back. I just put this on here too to talk about collaborate with speech language therapists or rehab professionals to learn adaptive communication strategies and tools. Asking those questions: how can I communicate better with my loved one? What are ways that I can make the communication process easier for the both of us, right? Just asking those questions and getting that information and knowledge. But I think too, building confidence really comes with, celebrating the small wins, the daily wins. If someone, one of your care partners eats their meal successfully, or they walk, or they smile, like all those small moments build up to those major accomplishments. And so one thing that I like to do, and this is just in life in general, or something or relating to, so I have a small wins jar. So I know it sounds very like impractical, but it is really practical because what you can do is over time you can see, actually these small wins are filling the top of a jar, right? So I can visually see that these small, achievements that are happening, they're working and they're going towards something greater. So that's just a thing that I do, but it's something that you can to apply to your, situation. Making a small wins jar, because eventually that jar will fill up and those small wins will be big, but it allows you to be in the moment and be like, wow, so things are happening, even though I feel like everything around me is, I've lost control or I don't have control over these things. Something is working. That is a visual sign of that something is working. Something that I'm doing is working, or that I'm helping the process of is working. So yeah, I have another poll question. Let's see. Okay. Uh-oh, not yet. One second. Wrong question. I wanted to get information to see what kinds of caregivers with strokes do we have in here. So if you are, where are you in your caregiving journey? I just wanted to see the different type of participants that I had in here. Okay, looks like we have, most have been, looks like we have more people that's been doing it 10 plus years. And I applaud the the veterans, I would say, that have been doing this for a very long time. You could probably give me more tips and more things that I could take, but I think that just speaks to like where everybody is in their journey, and the things that, at different levels, you will learn different things and take different things, or you will be like, okay, that didn't really work for this, but this worked for this. So I think it's good to have a mix of all, and especially being in the place where connecting and connection is so important as to your journey and what happens. So isolation is something that really, it can change your view and your perspective on everything. So I'm gonna share these results, and that is also too gonna good segue into my next slide here. So I'm gonna stop sharing here, and okay, let's see. All right, so strengthening resilience, and the term resilience, is something that it's kind of like a buzzword, especially in the therapeutic space now. But and sometimes I think too it's kind of overused. But I think that for one, resilience in this space looks different for everyone, and definitely want to once again normalize common post-stroke emotional experiences, especially that the care partner is experiencing. So the frustrations, the shifting in family roles, the guilt, all these things, right? The tiredness, right? I'm constantly working, I'm constantly moving. That is something. But I think resilience is not about perfection. I think it's about recovery and flexibility. That to me is what resilience is. It's not, I think, not about, okay, my loved one has to reach this milestone by this time or this. It's having the ability to recover and to be flexible. And so I really wanted to kind of create what are some protective factors. So now that we do have gotten to this place of resilience and connection, how can we maintain that? How can we keep that, right? So I did green light and yellow red light for protective factors, right? So some green lights. Let's do the good first, right? So, joining a peer online support group for shared understanding, right? I think there are people out there that are experiencing the same thing as you are experiencing, right? We want to make sure we have that village and people around. Yes, we have family, but there are also other strangers in the world that are going through the same things you're going through that, you could been there. Like when we shared the poll results, there were, let me see if I can pull them back up for reference. I think I can. Yep. So if we were to look at this poll here, there are 16% of 10 out of 64 people are new to caregiving. So that's somebody else that is sharing that same exact experience as you are. But like I also too believe that it is important to have all levels of caregiving in the room because you want to talk to those 10-year people who have been doing it, the 30 people in here that have been doing it for a very long time because they have wisdom and insight that someone new may not have, or the new caregivers might have something to give to everybody. I'm just a big firm believer in everybody has something to input and share. Um, you all are the experts of this because this is your reality. To me, experience is one of the best teachers. So you all have something that if I was a researcher or just a person out on the outside that I would not have insight to. So everyone has something very valuable to say. So the yellow light, and I say yellow is because you want to make sure that we are kind of pumping the brakes if we start to see these things so that it does not have to turn into a full stop. I have to stop doing this, right? Prevention, I think, is very important and we really want to do that. And so if you feel yourself withdrawing or isolating when feeling overwhelmed, we maybe need to pump the brakes to be like, let's use my village. Let's try to talk to other people. Another green light is maintaining regular exercise, rest, and balanced nutrition. That is very hard to do, especially when you have a 10,000 other things going on. But our bodies help us to do these things. And if I cannot pour into myself, how can I help and pour into my loved one, right? My therapist always says you can't pour from an empty cup. And so eating is something that's essential to life. Resting is something that's essential to life. So, you know, um, it's just important that we continue to think about those small things, or try at least to put an effort towards that. Skipping meals, of course, we want a yellow red light. Skipping meals or rest because of guilt or time pressure, right? Um, I think it's just a matter of making things work. What works best for you? So making it work for your schedule, I think is important. Another green light is positive reframing, so practicing and using humor to release tension. I love to laugh. Laughing is one of my favorite ways to kind of break the ice and release the tension that you have. Definitely a red light or yellow light, suppress or minimize emotions. I think is something that's very important it's like shutting down. We want to pay attention to and just be more aware of that. Sometimes, like I said, as humans, we naturally do this, but I think it's one thing for someone to just be like, I'm aware that, oh, this happens. I think awareness is always the first step. Now, you may need extra motivation or things to kind of help you move from that step, but if you can say, like, hey, I feel myself shutting down, or I feel myself kind of boxing these emotions. And don't get me wrong, I think compartmentalizing things sometimes is best, right? Especially if you are trying to get a task done or whatever. I always tell myself I give myself time boundaries when it comes to feeling things. So if I'm upset, or if I'm like really upset about something and I stop and I'm like, okay, I'm gonna give myself to the end of the day to be upset about this. That then allows to give me time to experience and feel, right? Because I need to feel these emotions because they won't go away. Me trying to ignore the fact that they're here, that's not a very good coping strategy. So putting myself with a time boundary to be like, okay, I'm going to be upset for this moment, just say an hour or two. I'm gonna cry, I'm gonna scream, I'm gonna do all these things. But when that time comes, I'm gonna figure out how I can get myself out of this. So you have now, for one, set a time boundary on how you're gonna give yourself time to feel. And then the second thing is now that I have gotten out of this, I'm gonna either talk to someone, talk to my support, or do whatever practices and coping strategies that I need to do to get myself out of it. Um, Creating self-care routines that includes emotional check-ins, right? So we do want to do that. Emotional check-in. How am I feeling about this? Do I feel like there's no way out of this, or just taking the time to stop and just stop and breathe and really check in on yourself. So, burnout or wanting to yellow or red light, or early warning signs of burnout or fatigue. So, really wanting to, like I said, pump the brakes and really just stopping and making sure that I'm aware of what's going on around me and what's happening. Okay. So, when you talk about support, um, we have here at NICPAD, the organization that I work for, we have a Care Partners Coffee Club. So, this is something that is open to all caregivers. You do not have to be a part of NICPAD or NICPAD Connect, but it is basically just kind of a way of judgment-free space for care partners to come in. Like yesterday, we just had one on giving yourself permission to be upset, giving yourself permission to be happy with the situation that you're dealing with, right? Really, it's just we have caregivers come on to just talk and share their experience. We have professionals to come on and talk about ways to deal, exercise, diet, spirituality, just all these different ways to kind of cope. So we meet every third Wednesday of the month at 9:30 Central Standard Time. So this is a free resource that you have, that my organization has, that you all could be a part of. It's a QR code. Also, too, if you go to our website or call our call center, we can get you connected with Stephanie. She is our coffee club, so that's coffee care partner coffee club coordinator. She's wonderful. So we can get you connected into services, because like I said, support is something that is so important in this process and this phase. So really wanting to get you connected. And two, just kind of talk about some of the menu of services that NICPAD has to offer in general. If you don't know about NICPAD, the organization that I'm a part of, we have different types. So that coffee club, or the Care Partner Coffee Club, is a support space that we have. We also do collaborative partnerships. We have a really good resource development. So if you're looking for resources for your loved one, we have a team that works really hard to make sure that they help people find the resources that they need specific to their area. We have program adaptations and training. So if you are a healthcare provider and you want to know how you can make your trainings, or have an extra want your staff, if you're in an administrative spot, or you see something, or you're in a healthcare space and you want to come in and have a training, we have those for that. We do evaluation, internship trainings. We really just try to tailor support to whoever, whatever. That's what I would say, whoever for whatever. So just kind of throwing what Nick Pad, what we do out there, so you have some means of support there. And of course, some other resources, we have the American Stroke Association Support Network, and we have the Family Caregiver Alliance. I think these tools are great, and especially if you actually use them for what they are for, right? Or actually use them to their maximum ability or what they have to offer. Um, I it's so important. I think this is the biggest part of caregiving or being a care partner for someone, that support part. So quick recap I wanted to before we did questions or not really sure how this is going to work, but um, one, I think the most important thing is to complete your stress cycle, the cycle that we talked about, getting to that recovery phase. I think is important because people get stuck in those other two. So trying to figure out how I can get to recovery and what that looks like, I think is important. So that'll help you, and it's something that you have to practice, right? Using small research-based coping tools, thinking about the mindfulness, the cognitive reframing that I mentioned about earlier, and how that can really change your experience. Um, Building confidence through communication and connection, right? Leaning on your support system, communicating your needs and wants. I know this is kind of like a cliche thing to say now, but stroke recovery is a marathon, not a sprint. And you do not have to run it alone. You don't have to be in this alone. As we mentioned, there are other people. We saw the other people that are a part of the same journey that you are. They're in the same space that you're in. I did have one more poll. Let's see. It's kind of a what would you try to do before? Let's see. Um, Oh, okay. So, which protective factor do you want to strengthen the most? So let's see what people say. And I'll go to the protective factors to go back to them so y'all can see. Here you go. Okay. So looks like most people are with the self-care routines. I definitely agree. Like that is definitely I think we all as humans should strive to try to maximize our self-care routine. I think too, just knowing that self-care doesn't necessarily have to look one specific way. Like uh, as I stated before when I was talking, like so I think some people think self-care is like we have to go to the spa and do all these like, extravagant things, but I feel like it's the things that bring you pleasure. Going to a favorite restaurant to get your favorite food. That's my favorite way of doing self-care, even though, like I said, eating is a necessity and we have to do it. But it's just something about eating my favorite dish or getting a dessert at the end of the meal and like just sitting there and enjoying the time. Let me share the results here. So yeah, self-care routine is definitely one thing. A positive mindset. I think that kind of the mindset that you have coming into something helps your experience. That goes kind of back to that self-efficacy thing of if I believe that this is going to work out and it's going to be okay, then that will happen. Exercise and rest. Rest is a hard thing to get, but definitely something that you have to work towards and put time and effort towards. The same as exercise, but now there are so many like resources to where you can do exercises sitting in a chair or doing different things. Social media has definitely caused us to our phones, and social media has definitely caused us to have access to information. That's why I say social media is good when it's used for the things it's supposed to be used for. So, um, finding exercises and doing things that I can get done really quickly, like I'm not the type to try to exercise for, I'm not, I used to be an athlete in school and all those things, but now I'm trying to just find small pockets of time where I work out and okay, I've reached my goal for the day and that's what it is, right? So just to not trying to fit into these, I don't have to be this great power lifter unless I want to be that, right? But I can also get the nutrients and things that I need for whatever, and I can do it in a way that brings me joy or pleasure to do it. Peer support, so definitely reaching out and being a part of those free groups. Like I said, NICPAD is a free resource that we have. The Care Partners Coffee Club that we have is a great free resource that happens that once a month, right? So, sometimes it's just, once again, it's just kind of starting, getting into the habit of, wanting to connect with people. Okay, let's see here. Um, Go to the end of my slide. So here is our contact information. Uh, so we are located in Birmingham, Alabama. Everybody's like, where y'all located? But we offer services to everybody around the United States because all of our services that we offer are virtual. So you can always, if you want to get started or get your loved one started with NICPAD, we always welcome people to come in. Our phone number, you can call our call center. I supervise the call center, so I'm the one that you probably will be talking to, or one of my call center workers. You can send us an email or visit our website. Our website has really good resources on there that are free once again. You can also really, like I said, just stay connected with all of our resources. We are a free service. So a lot of people, don't know, but yeah, there's no requirement. You just have to self-identify as somebody who has a physical disability. So once you do that, you can get started in our programming. Of course, I have to give a shout out to the CDC. This is why all of our services are free. So I always want to acknowledge that, they're the reason why we're able to offer so many people free services. And thank you. That is all I have for my portion of the webinar. I thank y'all for responding in the poll question, so I wasn't sitting here talking to myself. I see it's 136 people in here, so somebody's there, but it was nice for y'all to be a part of my webinar today.
Thank you so much, Kenya. Thank you for all of the valuable resources that individuals can connect with. Um, if anybody has any, lots of thank yous coming in, but if anybody has any specific questions for Kenya, please feel free to put them in the chat now. Otherwise, we'll give it a minute, and if we don't have any, we'll go ahead and just wrap up a few minutes early. Um, a lot of thank yous. I appreciate your information, Kenya. Great job. And so just give it just a 30 more seconds here, and then everybody can rest from a long afternoon of really great resources, really great learning, and really great connections.
I
So
look like some people asked, um, well, I don't know. I have one question.
someone asked earlier about online caregiver support groups.
Yes, that's what I saw. Yes.
Mhm.
In which I was able to provide. So you can I think it's Jess asked. Definitely give, if you go ahead and go to our website, we have free like I said, our caregiver support group that we have. There was also two more resources that I gave in a slide. Let me try to go back. Let's see. Oh, here we go. So the American Stroke Association Support Network, they have local chapters. It's kind of hard for us to do that because, like I said, we're a national service. But all of our support groups, so Coffee Club and our Care Partners Coffee Club is also free, and it's virtual, so you can join from anywhere. And the Family Care Alliance also has tools as well. And I'm also gonna put our QR code back up, so if you want to join, you can join. But if all fails and you can't remember the QR code, just Google us, nickpad.org, and that's really your place to start for real. Um,
Yep, and just I'll do a plug for if you can actually hear local brandery. association state affiliate, or if you connect with us here at the national office through our National Brain Injury Information Center, we can definitely help connect you to some of those support groups as well uh, in your area, or the ones that are virtual online if there's not one specifically in your area. So thank you so much, Kenya, for joining us today. I don't see any other questions coming in. So I think that, we've had a wonderful afternoon of learning. Thank you so much, everyone. Thank you again to our sponsor, Ipsen, for helping support this. We did record today, so we will try to get those out as quickly as possible, but give us a few days. And if you have any follow-up questions, please feel free to reach out to the individual who sent you the kind of the join links for today, and they'll be able to assist you with any issues you may have, either getting certificates or other or connecting to recordings or anything like that. Thank you so much.